The brain is the most interesting part of the human body. So join me as we explore the mental disorder iceberg. There are timestamps in the description, and as always, enjoy. Autism. Most people have heard of autism through awareness campaigns and media representation. It's a neurodevelopmental condition affecting communication, social interaction, and sensory processing. What surprises many is that autism exists on a spectrum. Some people need daily support while others aren't diagnosed until adulthood. The stereotypical image of someone who doesn't make eye contact is just one presentation. Many autistic individuals have exceptional abilities in specific areas, and the condition affects about 1 in 44 children, making it far more common than most realize. Depression, often called the common cold of mental health, depression affects over 280 million people worldwide. But there's a crucial difference between feeling sad and clinical depression. Real depression shuts down your brain's reward system. Food loses taste, hobbies become meaningless, and even basic tasks feel impossible. It's not sadness, it's numbness and exhaustion. What's particularly cruel is how depression lies to you, convincing you that you've always felt this way and always will, often striking even successful, seemingly happy people. Anorexia. Anorexia has the highest mortality rate of any mental health disorder, shocking people who think it's just about wanting to be thin. It's actually about control, perfectionism, and often trauma. The brain becomes hijacked, creating distorted reality where severely underweight people see themselves as overweight. It typically affects intelligent, high-achieving individuals, making the contrast between their success and their relationship with food even more tragic. Sleep paralysis. That terrifying experience where you're conscious but completely unable to move, often accompanied by hallucinations of shadowy figures or demons in your room. It happens when your brain wakes up before your body does during REM sleep. While it's actually harmless, the experience is so intensely frightening that many cultures have developed folklore around it. From the old hag in Anglo-Saxon tradition to pinyin in China. Nightmare disorder. While everyone has bad dreams, nightmare disorder involves chronic, severely disturbing nightmares that significantly impact daily life. These aren't just scary dreams. They're often so vivid and terrifying that people become afraid to sleep. The nightmares can be so realistic that people wake up confused about what's real, and the fear of having another nightmare creates a vicious cycle of sleep anxiety. Insomnia. In our 24/7 connected world, most people have experienced sleepless nights, but chronic insomnia is different. It's not just having trouble falling asleep occasionally. It's weeks or months of lying awake, watching the clock, knowing you need sleep but being unable to achieve it. The anxiety about not sleeping makes it worse, creating a feedback loop where worry about insomnia causes more insomnia. Specific phobias. These are intense, irrational fears of specific objects or situations. Spiders, heights, flying, needles. What makes them clinical is the extremity of the response and how much they interfere with daily life. Someone with a severe needle phobia might avoid all medical care, while someone with agoraphobia might become housebound. The fear response is so intense it can cause panic attacks, even though the person logically knows their fear is disproportionate. PTSD. Post-traumatic stress disorder gained recognition through military veterans, but it affects anyone who's experienced severe trauma. It's not just bad memories, it's your brain's alarm system getting stuck in the on position. The person's nervous system remains in a state of hypervigilance, constantly scanning for threats that aren't there. Internet gaming disorder, a relatively new condition reflecting our digital age's impact on mental health. It's not just playing games a lot, it's when gaming completely takes over someone's life. People lose jobs, relationships, and health because they literally cannot stop playing. The games are designed to be addictive, using the same psychological principles as gambling, creating a compulsion that can be as strong as substance addiction. Substance use disorder. Addiction is widely understood, but people often underestimate how completely it rewires the brain. It's not a lack of willpower. Addiction literally changes brain structure and chemistry. The person's brain becomes convinced that the substance is necessary for survival, creating cravings so intense they override everything else, including basic self-preservation instincts. Attention deficit hyperactivity disorder is increasingly recognized, but it's often misunderstood as just being hyperactive or easily distracted. In reality, it's a complex neurological condition affecting executive function, the brain's ability to plan, focus, and control impulses. Social anxiety. While many people feel nervous in social situations, social anxiety disorder is debilitating fear of being judged or humiliated in social settings. It's not shyness, it's intense physical symptoms like sweating, trembling, and nausea at the thought of social interaction. The person knows their fear is excessive, but they can't control it, often leading to complete avoidance of social situations. Perfectionism. When taken to extremes, perfectionism becomes paralyzing. The person sets impossibly high standards and is devastated by any perceived failure. They might spend hours on tasks that should take minutes, or avoid starting projects because they can't do them perfectly. This isn't about wanting to do well, it's about terror of making any mistake whatsoever. Exploding head syndrome. Despite the alarming name, this is relatively harmless but startling. People hear loud explosion-like noises or crashes in their head when falling asleep or waking up. There's no pain, but the sound is so realistic and sudden that it can be terrifying. Scientists think it's related to the brain's transition between sleep states, but the exact cause remains mysterious. Generalized anxiety disorder. This goes far beyond normal worry. People with GAD experience persistent, excessive anxiety about everyday situations. Their health, family, work, finances. The anxiety is constant and exhausting, accompanied by physical symptoms like muscle tension, fatigue, and difficulty concentrating. Unlike specific phobias, the anxiety isn't focused on one thing. It's a general sense of dread about everything. Dyslexia. Often misunderstood as simply reading letters backwards, dyslexia is actually a complex neurological condition affecting how the brain processes written language. People with dyslexia often have average or above average intelligence but struggle with reading, spelling, and sometimes speaking. The frustration of being intelligent but unable to read as easily as peers can lead to significant emotional distress and academic problems. Body dysmorphia. This involves obsessive focus on perceived flaws in appearance that are either minor or don't exist at all. The person might spend hours examining themselves in mirrors, seeking reassurance about their appearance, or avoiding social situations entirely. Social media has made this condition more common, as people constantly compare themselves to filtered, edited images online. OCD, obsessive-compulsive disorder. While people often joke about being OCD when they like things organized, real OCD is a nightmare of intrusive thoughts and compulsive behaviors. The obsessions aren't just preferences, they're terrifying. Unwanted thoughts that feel completely alien to the person. Someone might have intrusive thoughts about harming loved ones, even though they'd never want to hurt anyone. The compulsions are desperate attempts to neutralize these thoughts. Checking locks dozens of times, washing hands until they bleed, or repeating phrases mentally. The person knows these behaviors are irrational, but the anxiety is so intense that they can't stop. What makes OCD particularly cruel is that it often attacks what people care about most. If you love your family, OCD gives you thoughts about hurting them. If you're religious, it gives you blasphemous thoughts. ODD, oppositional defiant disorder. This goes far beyond normal childhood defiance. Children with ODD display persistent patterns of angry, vindictive behavior toward authority figures. They're not just being difficult, they seem genuinely unable to comply with rules or requests, even when it's clearly in their best interest. These children often argue with adults, deliberately annoy others, and blame everyone else for their mistakes. What's particularly challenging is that they can be charming and well-behaved with certain people while being completely defiant with others. The condition often emerges around age 8 and can be a precursor to more serious behavioral problems if left untreated. Parents often feel helpless and blamed, especially when the child behaves perfectly at school, but is a terror at home. Transvestic disorder. This is a complex and often misunderstood condition involving recurrent sexual arousal from cross-dressing, but only when it causes significant distress or impairment in functioning. It's important to distinguish this from transgender identity or simple cross-dressing for fashion or comfort. People with transvestic disorder experience genuine distress about their arousal patterns and may struggle with shame and confusion about their sexuality. The condition can create significant relationship problems and internal conflict, especially in societies where gender expression is rigidly defined. Treatment often focuses on helping the person understand and accept their sexuality while developing healthy coping mechanisms. Schizotypal personality disorder. People with this condition live in a world where reality is fluid and personal meaning is found in random events. They might believe they have telepathic abilities, that strangers are sending them messages through the TV. or that their thoughts can influence world events. Unlike schizophrenia, they maintain some connection to reality, but their thinking is consistently odd and magical. They often dress unusually, have few close relationships, and struggle with social anxiety that doesn't improve with familiarity. Their speech might be vague or overly elaborate, and they often seem to exist in their own private world. What's fascinating is that they're often drawn to fringe beliefs, conspiracy theories, and paranormal phenomena, finding community in these subcultures. Brief psychotic disorder. Imagine losing complete touch with reality, hearing voices, seeing things that aren't there, believing in elaborate delusions, and then suddenly snapping back to normal as if nothing happened. That's brief psychotic disorder. The person might spend days or weeks convinced they're being followed by the CIA or that they're receiving messages from God, then wake up one morning completely lucid and horrified by what they believed. It's often triggered by extreme stress and can be so severe that hospitalization is necessary. The recovery is usually complete, but the experience is traumatic for both the person and their loved ones who watched someone they knew disappear into madness temporarily. Borderline personality disorder. BPD is like having emotional third-degree burns. Everything feels intensely painful, and normal interactions can cause overwhelming distress. People with BPD experience relationships as a matter of life and death, swinging between idealization and devaluation of others. They have an intense fear of abandonment that can lead to frantic efforts to avoid being left alone, including self-harm or suicide attempts. Their sense of self is unstable. They might not know their own preferences, values, or goals, instead taking on the identity of whoever they're closest to at the moment. The emotional pain is so intense that many engage in self-injury just to feel something different, or to externalize their internal agony. What makes BPD particularly challenging is that the person's behavior often pushes away the very people they desperately want to keep close. Schizoid personality disorder. These individuals are like human islands, completely isolated and seemingly okay with it. They have little interest in social relationships, rarely experience strong emotions, and prefer solitude to an extreme degree. Unlike people with social anxiety who want connection but fear it, schizoid individuals genuinely don't seem to need or want human contact. They're often described as cold or aloof, but it's not intentional cruelty. They simply don't experience social connection the way others do. They might go days without speaking to another person and feel perfectly content. Their emotional range is restricted, showing little response to praise or criticism. Interestingly, they often excel in solitary work and can be highly creative or intellectual, channeling their energy into projects rather than relationships. Gambling disorder. This isn't just bad luck or poor financial decisions. Gambling disorder hijacks the brain's reward system just like drug addiction. The person experiences the same high from gambling that others get from cocaine, and the tolerance builds over time, requiring bigger and riskier bets to achieve the same rush. What's particularly insidious is how gambling is normalized and even encouraged in society. The person might lose their house, destroy their marriage, and steal from family members, all while maintaining the delusion that the next bet will solve all their problems. The shame and secrecy surrounding gambling addiction often prevent people from seeking help until they've lost everything. Unlike substance addiction, there's no physical withdrawal, but the psychological craving can be just as intense. Histrionic personality disorder. Imagine needing to be the center of attention so desperately that your entire identity depends on it. People with histrionic personality disorder are like emotional chameleons, constantly performing to get attention and approval. They're often described as dramatic or theatrical, but underneath the performance is genuine terror of being ignored or forgotten. Their emotions are intense but shallow, changing rapidly based on their audience. They might dress provocatively, tell elaborate stories, or create drama to ensure they remain the focus. Relationships are often shallow because everything is performance. They struggle to form genuine connections when their entire sense of self depends on external validation. What's tragic is that despite being surrounded by people drawn to their charisma, they often feel deeply lonely and empty. Agoraphobia. Most people think agoraphobia is fear of open spaces, but it's actually fear of being trapped in situations where escape might be difficult, or help unavailable during a panic attack. The person becomes afraid of their own fear, creating a prison of avoidance that can become so severe they can't leave their house. It often starts with a panic attack in a specific place, a grocery store, bus, or bridge, and then generalized to similar situations. The fear isn't of the place itself, but of having a panic attack there and being unable to escape or get help. This can lead to increasingly restricted life, with some people becoming completely housebound. The cruel irony is that the safety behaviors meant to prevent panic attacks actually maintain the disorder by reinforcing the belief that these situations are dangerous. Alice in Wonderland syndrome. Named after Lewis Carroll's famous story, this neurological condition causes bizarre distortions in perception that would make the Mad Hatter seem sane. People experience their body parts as dramatically changing size. Their hands might feel enormous, their head tiny, or their limbs unnaturally long. Time perception becomes warped, with minutes feeling like hours, or hours passing in what seems like seconds. Objects in the environment might appear to grow or shrink, and distances become impossible to judge accurately. The condition is often associated with migraines, epilepsy, or brain tumors, but can occur on its own. What's particularly unsettling is that the person is usually aware that their perceptions are distorted, but can't make them return to normal. Imagine trying to navigate the world when you can't trust your own senses about something as basic as the size of your own hands. Narcissistic personality disorder. True narcissism goes far beyond healthy self-confidence or even arrogance. People with NPD construct an elaborate fantasy of their own superiority to protect against deep feelings of inadequacy and shame. They genuinely believe they're special and unique, deserving of admiration and special treatment. What makes them dangerous is their complete lack of empathy. Other people exist only as sources of admiration or obstacles to their goals. They can be charming and charismatic, but it's all manipulation designed to get what they need. When their grandiose self-image is threatened, they can become rageful and vindictive. The condition often develops as a defense against childhood trauma or neglect. But by adulthood, it's become so entrenched that the person has lost touch with any authentic sense of self beneath the grandiose facade. Antisocial personality disorder. This is the clinical term for what people commonly call sociopathy or psychopathy, and it represents a fundamental absence of conscience that most people find incomprehensible. Individuals with ASPD don't just break rules occasionally. They seem incapable of understanding why rules exist in the first place. They view other people as objects to be manipulated for their own benefit, without any genuine emotional connection or remorse. What makes them particularly dangerous is their often superficial charm and intelligence, allowing them to blend into society while causing tremendous harm. They might seem like the perfect employee, romantic partner, or friend, but it's all performance designed to get what they want. The absence of genuine empathy means they can hurt others without the emotional cost that would stop most people. They often have a history of childhood conduct disorder, including cruelty to animals, persistent lying, and aggression. But some are skilled enough to avoid detection well into adulthood. The most chilling aspect is that they often understand emotions intellectually and can mimic them perfectly, but they don't actually experience them in any meaningful way. Pica. While it might sound relatively harmless, pica involves compulsively eating non-food substances for at least a month, and it can be life-threatening. We're not talking about a toddler occasionally eating dirt. This is persistent consumption of items like starch, ice, paint chips, chalk, or even more dangerous substances like metal objects or feces. In adults, it's often associated with developmental disabilities, but it can also occur in people with iron deficiency, pregnancy, or severe mental illness. The medical complications can be severe: intestinal blockages, poisoning, infections, or dental damage. What's particularly disturbing is that people with pica often hide their behavior due to shame, leading to delayed medical treatment when complications arise. The compulsion can be so strong that people risk their health and safety to satisfy their cravings for inedible substances. Treatment is challenging because the behavior often serves a psychological function, providing comfort or sensory satisfaction that's difficult to replace with healthier alternatives. Oneirophrenia. This rare condition blurs the line between waking and dreaming consciousness in a way that's both fascinating and terrifying. People with oneirophrenia experience dreamlike states while awake, complete with vivid hallucinations, bizarre thought patterns, and emotional experiences that feel completely real but have no basis in reality. Unlike schizophrenia, which involves persistent delusions, oneirophrenia is more episodic and dreamlike in quality. The person might have elaborate conversations with people who aren't there, experience complex storylines playing out in their mind, or feel like they're living in an alternate reality. What makes it particularly unsettling is that the experiences can be so vivid and emotionally compelling that the person has difficulty distinguishing them from real memories. It's often associated with severe sleep deprivation, substance use, or certain medical conditions, but can sometimes occur spontaneously. The condition challenges our understanding of consciousness itself. If someone can experience full sensory and emotional realities that exist only in their mind, also known as Declaire-Humboldt syndrome, this involves the fixed delusion that someone, usually of higher social status, is secretly in love with the person. This isn't just wishful thinking or a crush. It's an unshakable belief that often leads to stalking behavior. The person interprets neutral or even negative interactions as secret declarations of love, creating an elaborate fantasy relationship that exists only in their mind. They might believe that a celebrity, politician, or even a casual acquaintance is communicating their love through subtle signs. A glance, a gesture, or even seemingly unrelated events like news stories or song lyrics. What makes erotomania particularly dangerous is that the person often becomes increasingly intrusive in their attempts to respond to this imaginary courtship, leading to harassment, stalking, and sometimes violence when their advances are inevitably rejected. The delusion is so strong that contrary evidence only strengthens their belief. Rejection is interpreted as the person being forced to hide their true feelings. This condition has been responsible for numerous celebrity stalking cases and can persist for years despite legal intervention, therapy, and medication. Factitious syndrome. Perhaps one of the most disturbing psychological conditions, factitious syndrome involves deliberately producing or feigning illness to assume the sick role and receive medical attention. This isn't malingering for financial gain or to avoid responsibility. People with factitious syndrome genuinely crave the care and attention that comes with being ill, even at enormous personal cost. They might inject themselves with bacteria to cause infections, take medications to produce symptoms, or even undergo unnecessary surgeries. The most extreme form, Munchausen syndrome, involves a pattern of traveling from hospital to hospital, assuming different identities, and subjecting themselves to painful and dangerous medical procedures. What's particularly tragic is that these individuals often have extensive medical knowledge and use it to harm themselves convincingly. When healthcare providers become suspicious, the person often becomes angry and moves on to a new provider or hospital. The condition is thought to stem from severe childhood trauma or neglect, with the hospital environment providing a sense of safety and care that was absent in their early life. Some individuals escalate to Munchausen syndrome by proxy, deliberately causing illness in their children or dependents to receive attention as a caregiver. Bulimia. While often grouped with anorexia as an eating disorder, bulimia has its own particular horror that's often hidden from view. Unlike anorexics who visibly waste away, people with bulimia often maintain normal weight, making their suffering invisible to others. The cycle of binge eating followed by purging creates a secret world of shame and physical devastation. During binges, the person feels completely out of control, consuming thousands of calories in a short period, often eating until they're in physical pain. The purging that follows, through vomiting, laxatives, or excessive exercise, is an attempt to undo the binge, but it creates its own set of problems. Frequent vomiting erodes tooth enamel, causes chronic sore throats, and can lead to dangerous electrolyte imbalances that affect heart rhythm. The shame surrounding bulimia is intense because the behavior often feels disgusting even to the person doing it. They might hide evidence of binges, lie about their eating, and live in constant fear of being discovered. What makes bulimia particularly insidious is that it can be maintained for years without detection, causing gradual but serious medical complications while the person appears to function normally in other areas of their life. Tourette syndrome. Most people's understanding of Tourette's comes from media portrayals focusing on vocal tics, especially coprolalia, involuntary swearing. But this represents only a small percentage of cases. The reality of Tourette's is far more complex and often more disabling than people realize. Tics aren't just random movements or sounds. They're preceded by an uncomfortable sensation called a premonitory urge, similar to the feeling before you sneeze. The person can sometimes suppress tics temporarily, but it requires enormous mental effort, and the tics often return more intensely later. Motor tics can range from simple eye blinking to complex movements that look purposeful but aren't under voluntary control. Vocal tics might include throat clearing, sniffing, or repeating words or phrases. What's particularly challenging is that tics often worsen during times of stress, excitement, or fatigue, and can be temporarily suppressed in certain social situations, leading others to believe the person has more control than they actually do. Many people with Tourette's also have comorbid conditions like OCD or anxiety disorders, creating a complex web of neurological and psychological challenges that affect every aspect of daily life. Schizophrenia, often misunderstood as simply split personality. Schizophrenia is a severe psychotic disorder characterized by disruptions in thought processes, perceptions, emotional responsiveness, and social interactions. People with schizophrenia may experience hallucinations, hearing voices or seeing things that aren't there, delusions, fixed false beliefs, disorganized speech and behavior, and negative symptoms like reduced emotional expression and motivation. The condition typically emerges in late adolescence or early adulthood and can lead to significant impairment in daily functioning. What makes schizophrenia particularly devastating is how it can rob individuals of their ability to distinguish reality from their internal experiences, leading to profound confusion and isolation. Despite common misconceptions, schizophrenia is not about having multiple personalities. It's a fragmentation of the mind's ability to process reality, often requiring lifelong treatment and support. Dissociative identity disorder, formerly known as multiple personality disorder, DED involves the presence of two or more distinct personality states that control a person's behavior at different times. These identities, often called alters, may have their own names, ages, genders, mannerisms, and even physical characteristics. The condition typically develops as a response to extreme childhood trauma, creating a mental escape where the person disconnects from their experiences. Switching between identities can be sudden and distressing, sometimes accompanied by memory gaps for important personal information. What makes DID particularly complex is the internal system of identities that may be unaware of each other or in conflict, creating internal chaos and amnesia barriers. The condition challenges our understanding of consciousness and identity, showing how the mind can compartmentalize unbearable experiences into separate selves to survive. Parental alienation. This psychological phenomenon occurs when one parent systematically turns a child against the other parent, creating a form of psychological abuse that can have lifelong consequences. The alienating parent uses various tactics including bad-mouthing the targeted parent, interfering with visitation, creating false accusations, and gradually erasing the targeted parent from the child's life. What makes this particularly insidious is that the child often becomes an unwitting accomplice, genuinely believing that the targeted parent is bad or dangerous. The alienated child may refuse to see or speak to the targeted parent, express hatred or fear that seems disproportionate to any actual wrongdoing, and may even make false accusations of abuse. The long-term psychological damage can be severe, including depression, anxiety, substance abuse, and difficulty forming healthy relationships in adulthood. The child often realizes the manipulation later in life, leading to profound grief over the lost relationship with the targeted parent and anger at being used as a weapon. This phenomenon is particularly cruel because it weaponizes the natural trust children have in their parents, turning love into a tool of destruction. Dependent personality disorder. While everyone needs some degree of support from others, people with dependent personality disorder have such an extreme need to be taken care of that they become unable to function independently. They experience genuine terror at the thought of being alone or having to make decisions for themselves. This goes far beyond normal relationship dependency. They might be unable to choose what clothes to wear, what to eat, or where to work without extensive reassurance from others. They often enter relationships with controlling or abusive partners because any relationship feels safer than being alone. The fear of abandonment is so intense that they'll tolerate abuse, humiliation, and exploitation rather than risk being left. When relationships end, they desperately seek immediate replacement relationships, often making poor choices in their urgency to avoid being alone. What makes this condition particularly tragic is that the person's excessive neediness often drives away the very people they depend on, creating a cycle of abandonment that reinforces their fears. They may sacrifice their own needs, interests, and values to maintain relationships, essentially disappearing as individuals in their desperate attempt to avoid abandonment. Rumination disorder. This disturbing condition involves the repeated regurgitation and re-chewing of food that has already been swallowed, continuing for at least a month. While it's most commonly seen in infants and people with intellectual disabilities, it can occur in otherwise healthy individuals. The person brings up partially digested food into their mouth, re-chews it, and either swallows it again or spits it out. This isn't caused by a medical condition. It's a behavioral pattern that often develops as a form of self-soothing or stimulation. The behavior typically occurs within 30 minutes of eating and can happen multiple times per day. What makes this particularly concerning is the social isolation it creates. The smell and appearance of regurgitated food makes social eating impossible, leading to shame and withdrawal from others. Medical complications can include malnutrition, weight loss, dental problems from stomach acid, and social rejection. The condition often develops during times of stress or neglect and can persist for years if untreated, fundamentally altering the person's relationship with food and social interaction. Bipolar disorder. While many people have heard of bipolar disorder, few understand the true devastation of experiencing extreme mood episodes that can last weeks or months. During manic episodes, the person feels invincible and euphoric, needing little sleep, talking rapidly, and making grandiose plans that seem brilliant at the time, but are often disastrous in retrospect. They might spend their life savings, quit their job impulsively, or engage in risky sexual behavior. The energy and confidence can be intoxicating, which is why many people with bipolar disorder resist treatment. They miss the highs. But mania can escalate to psychosis with delusions of grandeur and hallucinations. The depressive episodes are equally extreme, involving profound hopelessness, inability to feel pleasure, and often suicidal thoughts. What's particularly cruel is that the person maintains enough insight between episodes to see the wreckage their illness has caused: destroyed relationships, financial ruin, and lost opportunities. The unpredictability of mood episodes makes long-term planning nearly impossible, and the person often feels like they're living with a stranger in their own mind. Kleptomania. This goes far beyond shoplifting or stealing for financial gain. Kleptomania involves an irresistible urge to steal items that the person doesn't need and often doesn't even want. The stealing isn't planned or motivated by anger or revenge. It's an impulse that builds like pressure until it must be released. The person often feels tension before stealing and relief or gratification afterward, similar to the cycle experienced in other impulse control disorders. What makes this particularly puzzling is that people with kleptomania often have the money to buy what they steal, and may even throw away or give away the stolen items afterward. They're typically law-abiding in all other respects, and feel tremendous guilt and shame about their stealing. The condition often develops during adolescence and can persist for decades if untreated. The legal consequences can be severe, and the shame can lead to social isolation and depression. Many people with kleptomania also struggle with other mental health conditions, including depression, anxiety, eating disorders, and substance abuse, suggesting underlying issues with impulse control and emotional regulation. HPPD, hallucinogen persisting perception disorder. Imagine taking a psychedelic drug and having the effects never completely wear off. That's the reality for people with HPPD who continue to experience visual disturbances, perceptual distortions, and sometimes full hallucinations weeks, months, or even years after their last drug use. They might see trails following moving objects, experience walls breathing or moving, see geometric patterns overlaying their vision, or have difficulty distinguishing between colors. The condition can develop after a single use of drugs like LSD, psilocybin, or MDMA, and there's no way to predict who will develop it. What makes HPPD particularly distressing is that the person is usually completely sober and aware that what they're seeing isn't real, but they can't make it stop. The visual disturbances can be mild and occasionally noticeable, or so severe they interfere with driving, reading, or other daily activities. Some people also experience anxiety, panic attacks, and depression related to their persistent symptoms. There's no reliable treatment, and the condition can be permanent, serving as a stark reminder that some experiences can fundamentally and irreversibly alter brain function. Diogenes syndrome. Named after the ancient Greek philosopher who lived in extreme simplicity, this syndrome involves severe self-neglect and compulsive hoarding that creates living conditions so deplorable they pose serious health risks. People with Diogenes syndrome often live in squalor, surrounded by years or decades worth of accumulated garbage, human waste, rotting food, and vermin. They may not bathe for months, wear the same clothes until they fall apart, and ignore serious medical conditions. What distinguishes this from ordinary hoarding is the complete breakdown of self-care and social functioning. The person often becomes a recluse, avoiding all human contact and living in conditions that would be unbearable to most people. The smell alone can be detected from outside their homes, and when authorities finally intervene, they often find conditions that require hazmat suits to navigate. The syndrome typically affects elderly people living alone and may be related to dementia, depression, or other mental health conditions. What's particularly tragic is that many of these individuals were once functional members of society. Teachers, professionals, parents, who gradually withdrew from the world until they became almost feral in their isolation and self-neglect. Stendhal syndrome. This rare psychosomatic condition involves physical and emotional reactions to beautiful art or natural scenery that are so intense they can cause fainting, heart palpitations, hallucinations, and temporary confusion. Named after the French author who first described experiencing it while viewing art in Florence, the syndrome typically occurs when someone encounters art or beauty that they find overwhelmingly moving. The person might experience rapid heartbeat, dizziness, confusion, and even temporary amnesia when viewing certain paintings, sculptures, or natural landscapes. What makes this condition fascinating is that it suggests art and beauty can literally be too much for the human nervous system to handle. The syndrome is most commonly reported in Florence, Italy, where tourists occasionally require medical attention after visiting art museums. Some researchers question whether it's a distinct condition or simply a form of panic attack triggered by aesthetic experiences, but those who experience it describe something far more profound than mere anxiety. A sense of being overwhelmed by transcendent beauty to the point where their normal psychological defenses break down completely. Frigoli syndrome. This rare delusional disorder involves the belief that different people are actually the same person in disguise. The person becomes convinced that one individual, often someone they know, is following them around, constantly changing their appearance to avoid detection. They might believe their neighbor is disguising himself as their doctor, mailman, grocery store clerk, and various strangers they encounter throughout the day. What makes this particularly disturbing is the paranoid quality of the delusion. The person feels constantly watched and pursued by this shape-shifting individual. Unlike other delusions that might be relatively benign, Frigoli syndrome creates a world where the person can never feel safe because their persecutor could be anyone. The condition is often associated with brain injuries, dementia, or psychiatric disorders, but can occasionally occur in otherwise healthy individuals. The delusion is typically very specific and detailed, with the person able to explain exactly how they recognize the disguised individual despite their changed appearance. Treatment is challenging because the delusion is often unshakable, and the person may become aggressive toward the people they believe are in disguise. Abulomania. This condition involves pathological indecisiveness so severe that the person becomes essentially paralyzed by choice. While everyone experiences difficulty making decisions occasionally, people with abulomania are tormented by even the simplest choices. What to wear, what to eat, which route to take to work. The indecision isn't just annoying, it's agonizing, causing intense anxiety and sometimes panic attacks. The person might spend hours agonizing over trivial decisions, constantly second-guessing themselves and seeking reassurance from others. What makes this condition particularly debilitating is that it affects all aspects of life: career choices, relationships, daily activities, making normal functioning nearly impossible. The person often becomes dependent on others to make decisions for them, but even then they may be tormented by doubt about whether they should follow the advice. The condition can be so severe that people miss opportunities, avoid commitments, and become socially isolated because making any choice feels impossible. The underlying fear seems to be that making the wrong choice will lead to catastrophic consequences, creating a cycle where the inability to choose becomes more destructive than any poor choice could have been. Boanthropy. This extremely rare condition involves the delusion that one is an ox or cow, leading the person to behave like cattle. They might insist on eating grass, walking on all fours, making mooing sounds, and living outdoors with actual cattle if possible. The condition is mentioned in historical texts, including the Bible's account of King Nebuchadnezzar, who allegedly suffered from this affliction. Modern cases are extraordinarily rare, but when they occur, they represent a complete break from human identity and social functioning. The person genuinely believes they are bovine and may become distressed when treated as human. What makes boanthropy particularly fascinating from a psychological perspective is how it demonstrates the fragility of human identity. If someone can completely lose their sense of being human and adopt the identity of another species, it raises profound questions about the nature of self-awareness and consciousness. The condition is typically associated with severe psychotic disorders or certain types of brain damage, but its rarity makes it difficult to study systematically. Narcolepsy. While many people think narcolepsy just means falling asleep unexpectedly, the reality is far more complex and frightening. True narcolepsy involves sudden, uncontrollable sleep attacks that can occur at any time, often accompanied by cataplexy, sudden loss of muscle tone triggered by strong emotions. Imagine laughing at a joke and suddenly collapsing, fully conscious but unable to move or speak. People with narcolepsy also experience sleep paralysis, hypnagogic hallucinations, vivid, often terrifying hallucinations while falling asleep, and fragmented nighttime sleep. The condition essentially means the boundaries between sleep and wakefulness break down, creating a nightmarish existence where the person never feels fully awake or fully asleep. They might fall asleep while driving, eating, or having conversations with no warning. The cataplexy can be triggered by laughter, surprise, anger, or excitement, making emotional expression dangerous. What's particularly cruel is that people with narcolepsy are often accused of being lazy or using drugs, when they are actually dealing with a serious neurological condition that makes normal life nearly impossible. Capgras syndrome. This rare delusional disorder involves the belief that a loved one has been replaced by an identical imposter. The person might recognize the physical appearance of their spouse, parent, or friend, but feel that the emotional connection is missing, leading them to conclude that the real person has been replaced. What makes Capgras syndrome particularly disturbing is the emotional conviction behind the delusion. The person may become fearful, angry, or even violent toward the imposter. The condition is often associated with neurological conditions like dementia, brain injury, or schizophrenia. Some researchers believe it results from a disconnect between the brain's facial recognition system and emotional processing, creating a sense of unfamiliarity toward familiar faces. The delusion can persist despite overwhelming evidence to the contrary, causing significant distress to both the individual and their family. Koro syndrome. This culture-bound syndrome, primarily reported in Southeast Asia, involves the intense fear that one's genitals are retracting into the body and will disappear. The person experiences acute anxiety and may use devices to prevent the perceived retraction, such as clamps or weights. What makes Koro syndrome particularly fascinating is how it reflects cultural anxieties about sexuality and body integrity. Episodes often occur in epidemics during times of social stress, spreading through communities as a form of mass hysteria. While the condition is rare outside specific cultures, it demonstrates how cultural beliefs can shape psychological symptoms in profound ways. Medical examinations show no physical changes, but the psychological terror can lead to panic attacks and even suicide attempts. Shared psychotic disorder. Also known as folie à deux, this rare condition involves two or more people sharing the same delusion. Typically a dominant person who develops the delusion first and a more passive person who adopts it. What makes this condition particularly eerie is watching how delusions can be contagious under the right circumstances. The secondary person is usually in a close relationship with the primary person, spouses, siblings, or parent and child, and gradually begins to share their paranoid or grandiose beliefs. The delusions can be elaborate and detailed, involving conspiracy theories, persecution beliefs, or grandiose ideas about special powers or missions. What's most disturbing is that the secondary person often appears relatively normal in other respects and may even have insight into the absurdity of the beliefs when separated from the primary person. However, when together, they reinforce each other's delusions, creating an alternate reality that can become increasingly elaborate and disconnected from objective truth. Cases have been documented where entire families share the same delusions, creating isolated communities of shared madness. The condition raises fundamental questions about the nature of reality and how much of what we believe depends on social consensus rather than objective truth. Truman Syndrome. A modern delusion named after the Truman Show movie, this involves the belief that one's life is a reality TV show or that they're being constantly filmed for entertainment. People with this condition believe that their family, friends, and everyone they encounter are actors hired to participate in the show. They might look for hidden cameras, analyze conversations for scripted quality, or interpret coincidences as plot devices. What makes this condition particularly unsettling is how it reflects modern anxieties about privacy, surveillance, and authenticity in the digital age. The person lives in constant awareness of being watched and judged, making genuine human connection impossible because everyone is suspected of being a performer. They might try to break character by doing unexpected things, or test people to see if they're real. The condition has reportedly increased since the movie's release and the rise of reality TV and social media, suggesting that our media landscape can literally drive people insane by making paranoid delusions seem plausible. Some cases involve elaborate attempts to escape the show or expose the conspiracy, leading to increasingly erratic and dangerous behavior. Clinical lycanthropy. This involves the delusion that one can transform into an animal, most commonly a wolf, but also dogs, cats, horses, birds, or other creatures. The person genuinely believes they undergo physical transformation and may act out the behaviors of their animal identity. They might howl, growl, refuse to eat cooked food, or insist on sleeping outdoors. During episodes, they may claim to see fur growing on their body, feel their teeth becoming fangs, or experience other physical sensations of transformation. What's particularly chilling is that these episodes can be accompanied by aggressive behavior consistent with their animal identity, biting, scratching, or attacking others. The condition has been documented throughout history and across cultures, suggesting something fundamental about human psychology that can go catastrophically wrong. Modern cases are often associated with psychotic disorders, severe depression, or drug use, but some occur in otherwise healthy individuals. The person may have periods of normal functioning between episodes, making the condition even more disturbing for family members who witness the transformation from human to animal consciousness. Hysterical blindness. This condition involves genuine loss of vision with no physical cause. The eyes and visual system are completely normal, but the brain has essentially decided to stop processing visual information. The blindness is not fake or malingered. Brain scans show real changes in visual processing areas during episodes. It typically occurs following severe psychological trauma and represents the mind's attempt to avoid seeing something too painful to bear. What makes this condition particularly fascinating and disturbing is how it demonstrates the power of psychological trauma to create real physical symptoms. The person genuinely cannot see, may walk into walls, and require assistance with daily activities, yet their eyes respond normally to light and there's no physical damage. Recovery can be spontaneous and dramatic, vision returning suddenly when the psychological conflict is resolved. The condition challenges our understanding of the relationship between mind and body, showing how psychological states can create physical realities that are indistinguishable from organic disease. Alien hand syndrome. Imagine your hand developing a mind of its own, acting without your conscious control and sometimes directly opposing your intentions. That's the reality of alien hand syndrome, where one hand performs complex, purposeful actions that the person doesn't intend or control. The affected hand might unbutton clothes that the other hand just buttoned, grab objects without permission, or even attempt to harm the person or others. What's most disturbing is that the hand's actions appear deliberate and goal-directed, as if controlled by a separate consciousness. The person remains aware of what their hand is doing, but feels no sense of ownership or control over its actions. They might have to physically restrain the alien hand with their other hand, or sit on it to prevent it from acting. The condition typically results from brain damage affecting areas that coordinate movement and self-awareness, but the subjective experience is deeply unsettling, living with a body part that has apparently developed its own agenda. Some people report their alien hand performing helpful actions they hadn't consciously planned, while others struggle with a hand that seems actively malevolent, creating a nightmarish existence where they cannot trust their own body. Kluver-Bucy syndrome. This rare and devastating condition, typically caused by damage to both temporal lobes of the brain, creates a complete transformation of personality and behavior that's almost impossible to comprehend. People with Kluver-Bucy syndrome lose the ability to recognize objects by sight, despite having normal vision. They compulsively put everything in their mouth to identify it, including dangerous or disgusting objects. Their emotional responses become completely inappropriate. They show no fear of genuinely dangerous situations while remaining calm during normally frightening experiences. Perhaps most disturbing is the development of hypersexuality and indiscriminate sexual behavior toward inappropriate objects, people, or animals. They may attempt sexual contact with furniture, strangers, or anything that catches their attention. The person essentially loses all social inhibitions and survival instincts, requiring constant supervision to prevent them from harming themselves or others. What makes this condition particularly tragic is that the person often retains their intelligence and memory in other areas, making them aware of their bizarre behaviors but unable to control them. The syndrome represents a complete breakdown of the neural systems that govern recognition, emotion, and appropriate behavior, essentially creating a human being without the psychological mechanisms that make civilization possible. Apotemnophilia. This is perhaps one of the most disturbing psychological conditions imaginable. The intense desire to have healthy limbs amputated. People with apotemnophilia, also known as body integrity identity disorder, BIID, feel that certain body parts don't belong to them and experience overwhelming urges to have them removed. The desire isn't motivated by self-harm or suicidal ideation. Instead, they genuinely feel they would be more complete or correct with missing limbs. Some individuals spend years requesting amputations from doctors who refuse to perform unnecessary surgery on healthy limbs. In extreme cases, people have attempted self-amputation or deliberately caused severe injuries to force medical amputation. What makes this condition so disturbing is that those who do achieve amputation often report feeling satisfied and complete afterward, suggesting this isn't simply a form of self-destructive behavior, but a genuine neurological disconnect between body perception and body reality. The condition challenges fundamental assumptions about body ownership and identity, forcing us to confront the possibility that someone might genuinely be born in the wrong body in ways we never imagined. Some researchers theorize it may be related to a malfunction in the brain areas responsible for body mapping and self-recognition. Cotard syndrome, known as walking corpse syndrome, this is perhaps the most existentially terrifying mental condition possible. People with Cotard syndrome genuinely believe they are dead, don't exist, or have lost their internal organs, blood, or soul. They might insist that they're decomposing, that their organs have been removed, or that they died years ago and are now trapped in some form of afterlife. The delusion is so complete that they may refuse to eat because dead people don't need food, or insist they can't be hurt because they're already dead. Some believe they're immortal because they've already died, leading to dangerous behavior. What makes Cotard syndrome particularly horrifying is the complete existential despair it creates. Imagine being absolutely convinced that you don't exist or are trapped in death while still being conscious. The person experiences a form of psychological hell where they're aware but believe they shouldn't be. The condition often co-occurs with severe depression and can lead to catatonia or complete withdrawal from reality. Treatment is challenging because the person's entire perception of existence has been fundamentally altered. Recovery is possible but often incomplete, and some people retain residual beliefs about being different from living humans even after treatment. Pyrophilia. The sexual arousal from fire represents one of the most dangerous paraphilias known to psychology. Individuals with pyrophilia experience genuine sexual excitement from setting fires, watching fires burn, or being around fire and its aftermath. This goes far beyond normal fascination with fire. It's a compulsive sexual drive that often escalates over time. Many serial arsonists have been found to have pyrophilic tendencies, and the combination of sexual gratification with destructive behavior creates an extremely dangerous individual. The person might start with small fires, but escalate to larger, more dangerous blazes as they require more intense stimulation to achieve the same level of arousal. What makes this condition particularly terrifying is that the sexual gratification can override normal safety concerns and empathy for potential victims. The arsonist might achieve sexual climax while watching buildings burn, potentially with people trapped inside. Autophagia. The compulsive consumption of one's own body parts represents perhaps the most extreme form of self-destructive behavior known to psychology. People with autophagia compulsively bite, chew, and consume their own flesh, often starting with fingers, lips, or tongue, but potentially progressing to more serious self-cannibalism. This isn't simple nail biting or lip chewing. It's systematic consumption of body tissue that can result in serious injury, infection, and permanent disfigurement. The behavior often provides relief from anxiety or emotional distress, similar to other forms of self-harm, but the consumption aspect makes it particularly disturbing and dangerous. In extreme cases, people have consumed significant portions of their own fingers, tongues, or other body parts, requiring emergency medical intervention and sometimes amputation to prevent life-threatening infections. The condition is often associated with severe developmental disabilities, psychotic disorders, or extreme trauma, but can occasionally occur in otherwise functional individuals during periods of severe stress. What makes autophagia particularly horrifying is the primitive, almost cannibalistic nature of the behavior. The person essentially becomes both predator and prey, consuming themselves in a literal act of self-destruction. Folie en famille. The final entry in our descent into psychological horror. Entire families sharing the same delusion, creating isolated communities of collective madness that can persist for generations. Unlike shared psychotic disorder between two people, folie en famille can involve dozens of family members across multiple generations, all believing the same bizarre delusions. Historical cases have included families convinced they were royalty living in exile, families believing they were being pursued by government conspiracies spanning decades, or families convinced they possessed supernatural powers that required them to live in complete isolation from society. What makes this condition the ultimate psychological horror is how it demonstrates that entire lineages can become disconnected from reality, creating their own twisted version of truth that becomes more real to them than the actual world. Children born into these families grow up never knowing objective reality, instead being indoctrinated into elaborate delusional systems that may involve paranoid beliefs, grandiose fantasies, or complete reinterpretation of historical events. The isolation required to maintain these shared delusions often leads to extreme social withdrawal, creating family compounds or communities that exist entirely outside normal society. When authorities finally intervene, they often find multiple generations of people who have been living in an alternate reality for decades, raising profound questions about the nature of truth, the power of belief, and how completely the human mind can reconstruct reality when left unchecked by outside influence.